Terry Daly. I know a lot of people who only bring their cats to the vet when the cats are acting sick. I understand this. Cats resist traveling, especially to the vet, and a lot of people, myself included, feel bad about taking them anywhere. But it really is a mistake to skip that routine veterinary physical examination, and I'd like to talk a little bit about that. The truth is that we find a lot of diseases on routine physical exams in cats who seem perfectly healthy at home. These are what I'm going to refer to as secret diseases, disease that the cat is essentially hiding from us. Some of these diseases can cause chronic pain or discomfort for the cat. In other words, they affect the cat's quality of life. Some can also affect longevity, how long the cat lives. And some of the things we find can cause health problems for people. For a lot of these secret hidden diseases, there are fairly simple treatments, especially if we catch the problem early. So why do we, as humans, underestimate our cat's diseases? I blame it on this guy right here. This is an African wildcat and is the type of animal that our domesticated cats descended from. Unlike ourselves and most of our other domesticated animals, domestic cats descended from solitary animals like these. While our ancestors evolved depending on each other for survival, cats' ancestors evolved to depend only on themselves. Now, our cats evolved into social animals, but they retain some of the secretive, solitary traits of their ancestors. When I look around, I see friendly, helpful faces. And then, if I have a sunburn, a painful mouth, or an ingrown nail, I'll do what I evolved to do. I'll share my problems. I'm very good at this and may get some help, and at the very least, I'll get some sympathy. When African wildcats look around, they see prey and predators. And if they have a sunburn, painful mouth, or ingrown nail, they're going to keep it a secret. They won't make a peep. And that is why, when I do a routine physical exam on a healthy-seeming cat, I'll find something like this, or this, or this, or this. And it's a complete surprise to the people who live with the cat. They usually have no idea that their cat is sick. Okay, so each of these slides represents a disease that a cat might keep secret. I'll explain each of these, but my main point here is that cats can have a number of different secret diseases. So I have these other examples too. And I can get a little wordy, so this video is going to end up being a little longer than I originally anticipated. So I'm going to put a hyperlink on each slide with the idea that you can jump to any slide that you're interested in. Depending on how you're viewing this video, you may or may not be able to use these links. I'm also going to include links that will take you to other resources relevant to this video, including information to help you transport your cat. This first slide is probably my best example of why cats need routine examinations. A lot of people, if they have a cat with a mouth like this, are going to notice when the cat yawns, the bad breath and the tartar. But it's not that bad and doesn't seem to be bothering him, and maybe we can put off doing anything about it. But when I look at his mouth closely, under our bright fluorescent lights, I see two other things that are a much bigger deal. First, this cat has a broken canine tooth. On the outside, a broken tooth usually looks otherwise normal. This particular one doesn't, and I'll get to that in a moment, but here are some examples of broken teeth that look otherwise normal on the outside. Now, while they'll look normal on the outside, on the inside a broken tooth is probably infected. And if it is, it hurts a lot. Here's a radiograph, an x-ray of a normal cat canine tooth. Here are some radiographs of the crowns and roots of broken teeth. These are all diseased and painful and need to be treated. Usually with broken teeth in cats, people don't recognize any sign of pain until the tooth is extracted. Then they notice how much more active and playful the cat is. The second thing we see in this picture is less obvious, tooth resorption. And in this one photo, if you look closely, there are 4 instances of it, including on the tooth that also happens to be broken. This is a close-up of the most obvious. These are all very painful, they are all causing suffering, and the cat is keeping them all a secret. With resorptive lesions, such as these, people sometimes notice that the cat is eating differently, is less active, or isn't grooming well. Or they may not notice anything at all. When we do a physical examination on cats, we sometimes spend a lot of time looking at the mouth. These are good examples of why. We're not just looking at the tartar. Another common disease that can cause a painful mouth in cats is stomatitis. This is an extreme example, and usually by the time it gets this severe, the cat is eating less, and a lot of times people notice that the cat's breath is worse. But I do sometimes find mouths this bad on routine physical examination where the cats seem to be acting perfectly normal at home. I'll open the mouth and see this. Some cats are just that good at hiding pain. The arrows are pointing to the most severe areas of inflammation, but honestly, this whole mouth hurts. It is best to find this disease in its earliest stage, which most people won't notice at all at home. Here are some cats in whom the stomatitis is less severe, but still very painful. We want to find stomatitis early, not only because we want to prevent the pain that it is going to cause, but also because the prognosis is thought to be better if the disease is treated early. This is an example of something that might be no big deal to a cat. It might not cause any discomfort or really any problem at all, but it's worth finding because it can be a problem for other pets and for humans. This is a kitten with ringworm. You can see under the black light how some of the infected hairs fluoresce. You may have noticed that part of the routine physical exam for a kitten, but not for an adult cat, is to look at them under a black light. This is because adult cats will usually show some other sign, something like a little crusting of the skin or baldness. Kittens, however, may not show any signs at all. I've seen perfectly normal-looking kittens whose whole body fluoresced under the black light. A lot of people seeing this chin would think that their cat just had a dirty chin. What this really is feline acne. The arrows are pointing to little blackheads. If we shave the outlined area, we'd see that the underlying skin is a little inflamed. At this stage, it is probably not really causing a problem for the cat. But if it goes unrecognized and isn't at least monitored, it could progress into more serious disease. This is an example of an overgrown nail. The white line outlines the pad and the arrow points to the tip of the nail. At this point, a nail like this might not cause any problem, but if it continues to grow, it will grow into that pad and cause pain and infection. Here is an example of that. This overgrown nail is a good example of why it's better to find problems early. All this nail needs is to be trimmed regularly. If a cat is a lap cat and has a skin or eye tumor, people will usually find them at home. A lot of times it's easier to find them at home when the cat is relaxed. This is an example of a tumor, in this case a cyst, on the iris of a cat that you might not notice with normal household lighting. In this case, this is probably a benign cyst. The only thing I'd do for an eye that looks like this is to monitor it. If the cyst starts to grow or change, then it could become a problem. Now, I picked this mass to show because it makes a good photo example, but not all masses are this benign. We find a lot of masses, a lot of times by palpating, that can be a lot more serious. We commonly find arthritis in cats on routine physical exams. This is a radiograph of a cat with osteoarthritis. In the early to middle stages of this disease, at home, the cat may gradually become a little less active. As the disease progresses, they tend to lie around more and they usually avoid jumping. They seem to be getting older, and a lot of people think that they're just being normal cats. But even an older, overweight cat should be able to jump. When dogs get this disease, it's usually easy to notice in the early stages because the dogs are noticeably sore after vigorous exercise. But cats usually won't do that to themselves. Part of a routine physical for a cat is to palpate the joints. This is one of the things we are looking for, and based on that physical, we might recommend radiographs. The arrows are pointing to some of the affected areas of the hips. This cat needs treatment. Now, as an aside, I find that if I palpate a cat's hips during an exam and they show discomfort, a lot of times the people will immediately pet the cat to comfort them, and then the cat will stop reacting to my palpation. This kind of proves my point that cats will hide pain, but do realize that it also makes it harder for me to evaluate the cat. Part of the reason that I prefer for clients to not hold their cats during exams is that cats will be more honest with me than with their people. This is opposite of what you'd expect from a dog. In early stages of congestive heart failure, most cats aren't going to show any signs at all. With this disease, cats usually start to build up fluid within the chest, and most cats are able to hide any signs until it is fairly advanced. I see this a fair amount, where a cat will seem perfectly normal at home, and then suddenly, seemingly overnight, they are gravely ill and come to us with what turns out to be advanced heart failure that has actually been brewing for months to years. This is a radiograph of the chest of a healthy cat. You can clearly see the heart surrounded by the darker lungs. With advanced congestive heart failure, the fluid obscures the lungs. In this photo, the heart can't even be seen. It's in this area. If cats come in for a routine physical exam during the early stages of heart disease, before showing any signs at home, we will often find clues to this disease, such as a heart murmur or abnormal rhythm. and then we'll be able to treat them more effectively. Looking at this eye and lid, you might think that nothing significant is going on. The first thing that most people notice when looking at this photo is that dark strip to the right. That's just normal pigment, nothing to worry about. This is also nothing to worry about, just a little bit of crusting. But this is a big deal. This is a small ulcer in the lid. A sore like this could be from trauma, just a scratch, but if it doesn't heal on its own within a couple weeks, it is probably either cancerous or precancerous, and it needs to be addressed. That little lesion is potentially life-threatening. Something we find a lot of in Southern California, even in indoor cats, are fleas. This is an example of flea dirt found by combing through a cat. We'll find this in cats who aren't showing any signs. One of the reasons it's important for cats to not have fleas, even if they don't seem to be bothering the cat, is that a lot of cats are what we call closet scratchers. So fleas can be bothering cats without it being obvious to people. But another reason is that the fleas can carry organisms that can cause diseases in cats and in humans. And sometimes fleas from other species of animals will hop onto cats, and those fleas can also cause serious disease both in cats and in humans. A notorious example of this is bubonic plague, which, by the way, is very rare and usually very treatable, but you'd still rather not get it. A common disease that is underestimated is chronic low-grade constipation. This is a radiograph of a constipated cat. As with a lot of these secret diseases, the first sign might be that the cat is acting less playful, less like a kitten, more like a cat who's just getting a little older. Sometimes the only sign is that the cat is acting a little bit more finicky. Some people consider this normal for a cat, but it's really a sign of nausea. As the disease progresses, it will finally cause things like straining to have stool, weight loss, and vomiting. But by the time the problem becomes this obvious, it might have been going on for years. As with all these secret diseases, this is something we can sometimes pick up on routine physical exam, long before it becomes obvious at home. This amount of stool is usually easily discovered on abdominal palpation, but probably won't be noticed at home. Hyperthyroidism is one of the most common hidden diseases in older cats, and it is especially notable because it causes and/or hides other diseases. It causes diseases and it causes disease masking. Hyperthyroidism causes the cat's metabolism to increase, and when it does, in the early stages, the cats are acting great. Actually, sometimes better than normal. Like a person taking uppers, they are more active, they're eating well, they lose weight, they look great. Some cats are acting so well in the early stages that sometimes people don't want to even treat them. On the outside, it seems like a good disease. After all, the cats are acting better than they have in years. But while it is causing all these positive signs, it is also causing damage to the heart, the kidneys, and other internal organs. And at the same time, it is hiding other important diseases. So, for example, hyperthyroidism can cause kidney disease in cats, but you won't notice any sign of the kidney disease because the hyperthyroidism is hiding the signs. Eventually, the cats start acting very sick from this disease, but by then, some of the damage is already done. Keep in mind that these were all just examples of hidden diseases that we might find on physical exam. There are a lot of other examples. That routine physical exam really is important for the health and well-being of your cat. Thanks for watching.